You are listening to Hypertension Resistant to Treatment, where you will get knowledge, training, resources, and support for better blood pressure control. If you are suffering with high blood pressure or blood pressure that is difficult to treat, this podcast is indeed for you. Here is your host, Dr. Tanya.
Hi, I'm Dr. Tanya, and I am here to teach you everything you ought to know about hypertension management. I am a clinical scientist and I've done research over 10 years, and I've found some interesting things about hypertension and blood pressure control and medication taking behavior. I would like to share with you all of the information I've found, as well as all the information that's out there that will help you get control of your blood pressure. Stick with me and we'll take this journey to help you improve your blood pressure. Thanks for listening. Does this sound familiar? Or what about this? Now, don't get me wrong, not all snoring is sleep apnea, but snoring is a major risk factor or a major symptom of sleep apnea. So what is sleep apnea? Well, while you're asleep, you are having some trouble breathing or getting air into your lungs to circulate throughout your body. What we call desaturation or inadequate oxygen saturation. Now, this could be a problem. No, not just the snoring, but if snoring is sleep apnea. You see, if you're not getting enough oxygen to your brain, to your heart, and to your other vital organs while you're asleep, then these vital organs are probably being damaged. Now, if you're not getting enough air into your nose to go to your lungs and circulate around your body, then you're not getting enough oxygen to those areas. And if you're not getting enough oxygen, then this could be a big problem. But no worries, there is a simple fix for this, if this is a personal issue for you. If this is an issue for a loved one. That's what I want to talk to you about today. Hello, hypertension resistors. So today I want to talk about sleep apnea. And the reason why I want to talk about sleep apnea today is because sleep apnea may be the reason why you can't get control of your blood pressure, or it could cause a heart attack or a stroke. Therefore, I want you to be aware of what sleep apnea is, get tested if you have symptoms of sleep apnea, and if you are diagnosed with sleep apnea, get treated. And once there's enough oxygen that's not getting down to your lungs, your brain wakes you up so that you can reposition yourself to get some oxygen into your lungs. So the risk factors for sleep apnea are middle age, smoking, overweight or obesity, and being male. And the symptoms of sleep apnea other than snoring are morning headaches, waking up tired, unable to concentrate during the day, and daytime sleepiness. Now, as I said before, it's very important to get the sleep apnea diagnosed and treated so that you can prevent hypertension if you don't have hypertension, or even worsening of your hypertension, or just not able to get your blood pressure controlled with medication and diet and other lifestyle modifications. Congestive heart failure is where your heart is working very hard and it's unable to keep up with the pace of working very hard. And it puts you at high risk for heart attack and stroke. Now, if you suspect that you do have sleep apnea or a family member does have sleep apnea, if you think, well, they're snoring, let's get it checked out, just go to your primary care doctor and your primary care doctor will ask you several questions and do a little assessment on you and determine if you need to have a sleep study. And if you do need to have a sleep study, your primary care doctor will refer you to an ENT or a cardiologist or a specialist, a sleep study specialist, who will schedule a sleep study for you. And a sleep study is just an overnight study of monitoring your breathing, your heart rate, your oxygen saturation, and the extent of your snoring. Now, this test is not painful at all. It's just a matter of hooking you up to the equipment and monitoring you. And it can be done in the sleep lab or it can be done at home. Some people can get it done at home. Some insurances don't pay for a home test. And some people find the home testing equipment too difficult to apply. But usually it's very simple to apply. It's just two pieces. One gadget hooks up to your nose and the other gadget straps across your chest. And you connect those two gadgets together. Go to sleep for at least 6 hours, wake up, take the equipment off, return it to the sleep lab, and that's it. It doesn't involve any needles or any invasive procedure, which is great, right? Now, once they determine that you have sleep apnea, the sleep apnea could be reversed by using a CPAP machine. And CPAP stands for Continuous Positive Airway Pressure. This machine provides continuous pressure into your lungs during sleep. It's not really loud or anything. The machine itself is very quiet. And it just pushes the air into your nostrils, down to your throat, into your lungs, and your lungs provide your body with rich oxygenated blood to potentially keep you from having a heart attack, stroke, heart failure, and the like. And it might even cause you to be able to control your blood pressure with less medication. Now, most people have a little trouble getting used to that CPAP machine being on overnight while they sleep, but usually people get used to it. And some people even say they can't sleep without it. So give it a try and, don't give up. Just from my clinical experience, I've noticed that some people who can't get used to the CPAP are having a mask problem. In other words, they don't have the right fit for their mask. They need to go in and select a mask that's more comfortable for them. There are many different kinds, many different brands, so the selection or your choice or the options are out there. But once you get the right size mask, the right fit for you, and after a couple of nights, you'll get used to it. Although some people, even after several months, they're not used to it. But don't give up on it because this could be a matter of life and death, actually. So having that mask can save your life. Having that mask on and sleeping with it routinely could really save your life. Or it could prevent disability from a stroke or a heart attack. So keep wearing it if you are prescribed a CPAP machine to wear at night. And when you go on vacation, carry it with you and sleep with it all the time. Other ways to correct sleep apnea are to stop smoking, stop drinking alcohol, or lose weight. These are other treatments that could be recommended that might resolve your sleep apnea depending on how severe your apnea is. Now, usually the sleep apnea is described as mild, moderate, and severe. So if you have moderate to severe sleep apnea, more than likely your doctor will recommend this continuous positive airway pressure machine, which is a CPAP machine. And it provides continuous pressure into your airway to help your airway or your throat stay open while you're asleep on your back or side or usually if you're asleep on your back, that's a common position when this sleep apnea might be the worst or the most prominent. There are other devices that you could use or your doctor may recommend, like a dental sleep apnea device, which I don't know much about, but that could be a treatment. And there's also surgery, restructuring of the soft palate or jaw. Now, this sleep apnea is most common when you're sleeping on your back or when doing your dream sleep, because while you're on your back, your tongue is blocking your airway. Your soft palate is relaxing, and that allows just your tongue to block your airway. If you have sleep apnea. And it occurs in dream sleep, what we call REM sleep, because at that time, your body gets completely paralyzed during sleep. Your body does this to keep you from acting out your dreams. So during REM sleep, you may be at high risk for sleep apnea if you have it. During REM sleep, your partner may notice your sleep apnea or your snoring at that time. Having a family history of sleep apnea is also a risk factor for sleep apnea. It makes you more likely to have sleep apnea if your mother had sleep apnea or your dad or your grandfather or the like. So basically, your tongue just relaxes and fall back and block your throat. And then your brain keeps waking you up so that you can get enough oxygen. And this happens continuously throughout the night most times. So then that leaves your body with 10 to 15 seconds without oxygen, or it could be even longer. The lack of oxygen is the thing that causes the heart attack, the stroke, heart failure, and the like. To my knowledge, a sleep study is the only way to confirm that you have sleep apnea. But there are ways that you can spot check if your saturations are going down while you're snoring at night. So one thing you can do is get a pulse oximeter, and put it on your finger, tape it on your finger, and have your partner take a look at it once you start snoring and see what that number is, what your heart rate is, and what your saturation is dropping down to. But only a doctor can tell you what a good saturation is for you. So that's a spot check. Ask your doctor if that may be a way that you can spot check your oxygen saturation. Keep in mind, do not use that pulse ox as a way to rule out sleep apnea. If you snore, you may want to consider asking your doctor about a sleep study. Now, your complete blood count may suggest that you need a sleep study. If your hemoglobin or your hematocrit level or both are high, that may indicate that you may need a sleep study to confirm that you have sleep apnea. Because your body is trying to make more red blood cells in order to circulate more oxygen. That sleep apnea is giving your body a signal that you don't have enough red blood cells, but actually it's due to the fact that you have sleep apnea and you don't have enough oxygen, not red blood cells. But your body is trying to help you by making more red blood cells so that it can provide you with adequate oxygen. So if you notice that your hematocrit or your hemoglobin is elevated, that might be an indication that you have sleep apnea, and you may need a sleep study to confirm that. Now I will share with you an interview conducted by the American Sleep Apnea Association, and they interviewed Rich Brin. He has sleep apnea, and he will give you his story about how he was diagnosed and what he thinks about the CPAP machine.
I've had an awareness of sleep problems my whole life, and my father was the first in our family to officially be diagnosed and begin treatment, and then I had a sister that likewise. Later on, I realized how bad my snoring was. I was that guy who would wake up alone. My wife would be in another room. The only way that I was obtaining any sleep was to be sitting out on the couch myself, propped up. So a night of sleep could be 2 to 4 hours, and then I would have the horrible headaches and take my day and try to get myself going from that point forward. So I knew it was coming, and it took me a while, though. It took me a couple different attempts to finally be confirmed to have it and be able to get a CPAP and start treating for it. Was there a moment where it really hit me? I can't remember if it was the extreme high blood pressure episode that took me in and where that was in conjunction with that, but I knew it, and I had been trying to get it diagnosed so that I could do something with it. But the immediate attempts, my first attempts up in Iowa, were inconclusive, and I moved to Arizona, and the problem just got worse. And one day I was extremely red in the face, and I went in to only find out that my blood pressure was extreme. So I went on a hypertension medicine at that point in time, talking to my MD. He agreed that with my family heritage, it was time to go in and do a sleep test. So I did another one of those, finally diagnosed, finally began treating. Was the CPAP machine of concern? No, it wasn't, because I already had a father that was using one and a sister that was using one, and I was becoming more and more aware of it. So when they put me on the machine that night of my test, and I woke up feeling awkward because I was rested. I didn't realize what that feeling was. It had been so long since I'd really experienced that. And so when I finally got my machine and put it on that first night, I knew with the mask, I knew the way it was going to work. And my wife didn't sleep well that night because I was. She thought I was dead. I was finally resting. So as far as I go, I've been a patient that uses it. I've changed some masks. I've learned some different things. I can still have my jaw fall open, but I'm becoming more and more aware. I now do other things using my Apple Watch, my Fitbit, trying to track it. I've lost 40 pounds in the last year and a half, and I know I have 25 more to go. All these things help, but there's so many factors that you do to yourself that you have to realize, how can I sleep better? And that's one of the things that if I'm going to extend my life, I have to do that. The importance of compliance, to me, was never a question. I knew that I had the problem. So as far as I was concerned, I was going to find a way. I know a lot of people struggle with it. My father at times would rip his mask off, felt like, he was choking. So maybe he wasn't, titrated correctly or whatever the right medical terms are. It's really never been an issue for me. I know now that I have an allergy problem, and I use a Neomed type saline rinse. I take, medicines to try to deal with my allergies. So I can kind of tell when I'm getting out of kilter right now, when I'm off balance, and I have to do something so that I can recover and get back into a more appropriate sleep routine again. Getting the CPAP machine did make a huge difference. To just get up in the morning without a severe headache, without taking aspirin, you're so oxygen deprived that you're in this stupor. So it takes longer to get going. It's not just a cup of coffee, it's taking time for your oxygen levels to come back up so that you can start thinking clearly. So that scares me. I've done commercial insurance, and I know there's a lot of problems inherent to truck drivers and other things. I'm on the roadways, and I know that the person in the car next to me likewise could be sleep deprived. So I'm in that space seeing the outcomes, and they're horrible. So as far as I was concerned, I could immediately tell it. Like I said, that first night after having done the test, I felt different, and I didn't know what that was. And that was your body finally feeling somewhat rested and not being in a fog. And what's it like to be alert when you wake up? So as far as I was concerned, those things began to immediately have a great benefit to me. And there's so many other mood factors that you overcome. Your being short-tempered and your inability to focus. And so I worked extended days, really overcoming some of my mental health, let's just say, inability to be strong and to have strong acuity during the day.
So keep in mind, if you hear this, you might just be witnessing sleep apnea. Encourage your family or friend to get tested. And if people are telling you that you are doing this, then you might be having sleep apnea. Don't hesitate to go get tested. It's a simple test. It's overnight. It's quick and easy. No needles involved. For the confirmation sleep study, also known as a polysonogram. So, that's all I have for you today. Stay tuned to Hypertension Resistant to Treatment, where I'll tell you more about what you ought to know about hypertension and trending health topics. Thanks for listening, and I'll see you in the next one.